Good morning. My name is Chris Rubish. I am a RN negotiating team member at Essentia Health Duluth. I am a vice president of National Nurses United and president of the Minnesota Nurses Association. Today we are standing here together for a reason that should have never come to pass, a reason that is entirely unavoidable. We are here because Essentia Health would rather try and bust this advanced practitioner union than allow these providers a voice in their work and the care that they provide. With more than 80 years of bargaining history, Essentia Health has worked with workers on patient safety, fair wages, and better working conditions. But advanced practitioners in Essentia Health's East Market made a bold decision to file for representation with the Minnesota Nurses Association. Despite M&A's long history of negotiating with Essentia Health, these APPs were not met with respect, but with resistance. Rather than honoring their choice, as Essentia Health publicly committed to do, they initiated a series of calculated delay tactics, claiming that are clearly aimed at undermining and weakening this group's legitimate efforts to organize. To learn more about their organizing efforts and the reason that we are standing here today, I'm proud to turn it over to my colleague, Vicky Bradley.
Thank you, Chris. Good morning. My name is Vicky Bradley, and I am a nurse practitioner at St. Mary's Medical Center in Duluth. I'd really like to thank you for the opportunity to speak directly to the public about our unfair labor practice strike. As you may or may not know, the Essentia Advanced Practice Providers voted to unionize in July of last year by an overwhelming margin. During our organizing campaign, Essentia promised that if we did vote to unionize, they would negotiate with us in good faith. Unfortunately, that is not what has happened. The organization decided that they did not like the composition of our union, so appealed to the National Labor Relations Board. After months of testimony and introduction of evidence, the regional NLRB voted in our favor. Did this lead to the good faith negotiation that Essentia had previously promised? It did not. Essentia has appealed the decision to the National Labor Relations Board in Washington, D.C., and in the meantime has refused to begin the bargaining process, despite the regional directors ruling that they are legally obligated to do so. Advanced practice providers are the backbone of rural health care. We perform almost 50% of all clinic encounters and 85% of encounters in acute care settings like the hospital, emergency department, and urgent care. APPs, give exceptional, evidence-based, patient-centered care that is the reason why Essentia has such an excellent reputation in the communities they serve. Essentia often speaks about their values: quality, hospitality, respect, joy, justice, stewardship, and teamwork, and how they live those values each day. Unfortunately, that has not been reflected in their treatment of advanced practice providers. They have not shown respect by meeting us at the bargaining table. They have not honored the legal obligation outlined in the NLRB ruling to begin negotiations, even while their appeal is pending. And they have committed various other unfair labor practices in the meantime, like making changes to our working conditions without negotiating with us. Our outstanding team of negotiators have bent over backwards to try and get Essentia to simply answer questions such as how many APPs work for the organization, and have not been given even the courtesy of a reply. We are not on the strike line because Essentia has not met our demands. We are on the strike line because Essentia is unwilling to even ask what our demands are. Martin Luther King Jr. has said that there comes a time when the only weapon we have left in our hand is protest. That is where we find ourselves today. And until Essentia is willing to treat us with the respect that I feel we have earned, this may remain the only option we have. Thank you.
Good morning, everybody. My name is Gideon Peterson, and I'm a physician assistant in the urgent care here at Essentia Health in Virginia. Essentia Health is breaking the law. It's breaking its promises to its employees and to its patients. In November of 2023, advanced practice providers in Essentia Health's East Market filed for union representation. Essentia told us directly, if you vote for a union, we will bargain with you in good faith. On July 23, 2024, we overwhelmingly won the election. Instead of honoring their word, Essentia refused to come to the table and immediately filed an appeal with the National Labor Relations Board. The NLRB ruled in our favor, making it clear that Essentia is legally obligated to negotiate with us. Still, Essentia refuses and has filed yet another appeal, delaying negotiations, defying the law, disrespecting the people who keep their clinics running. The refusal only reinforces why we voted to unionize in the first place. For the past 5 years, I've seen decisions made behind closed doors that directly affect patient care, workers' well-being, with no input from those of us on the front lines. When I was hired at the Virginia Urgent Care Clinic, I was told we'd be open Monday through Saturday and closed on major holidays. Within the first year, leadership expanded hours to 7 days a week, including holidays, adding 59 potential workdays to my schedule throughout the year. Of course, through all this, I had no consent or even any meaningful conversation with my leadership about any of this. Even now, Essentia regularly fails to staff providers appropriately. If the staff is short, I'm left to handle every patient who walks in, whether it takes me 10 hours or 13. There's no accountability, no backup, and no say from us. Essentia admits that APP are responsible for 88% of urgent care visits. We are the system's answer to delayed access to primary care. In our rural communities, we are not convenience, we are a necessity. Patients tell me every day that they gave up trying to see their primary care provider and just come to urgent care instead. We need safe staffing, we need a voice, and we need a seat at the table. It's time for Essentia Health to follow the law, honor its commitments, and begin bargaining in good faith. Negotiating costs nothing. Refusing to negotiate and instead paying $1,500 per shift to a doctor to cover my work, plus another $700 if they also come off of PTO, is not only not unsustainable, it's an irresponsible use of resources, especially for a health system that constantly speaks to us about the challenges of rural health care. This kind of spending should raise serious questions. Our patients deserve better, and so do we. Thank you.
Good morning. I am Jenna Coldwell, and I have been a PA on the hospitalist team at Essentia for over 11 years. In Essentia's East Market, we have over 400 advanced practice providers, or APPs, including nurse practitioners, physician assistants, certified nurse specialists, and certified nurse midwives. Together, we provide primary and specialty care, surgeries, emergency and hospital care. We do research and quality projects, and we deliver babies. Often, we are the solo medical provider at rural hospitals and clinics, preserving accessible care and a human touch for patients in an era of increasing telemedicine. Per Essentia's data, we provide 44% of all patient visits. We are here today because our resilience and ability to continue providing high-quality care for our patients is threatened. Because we are exhausted to the point of neglecting ourselves and our families. Our employers' expectations grow constantly. See more patients, do more with less, double or triple book, hours of commute to cover distant facilities, work weekends, add night coverage, add more call. And we have no say, there is no negotiation, and any concerns over the years have widely been met with shrugs and empty promises. We organized our union in order to keep doing the jobs we love. We fought a long legal battle involving an NLRB hearing to keep this union, which was certified in July 2024. And today, we are striking because Essentia has refused for the past year to even begin to talk with us at the bargaining table. Instead, they have ignored our legal union status. And in the interim, our APPs continue to be broken down. In fact, we have lost many of our most experienced and irreplaceable APPs along the way due to this protracted refusal to bargain and improve our working conditions. Instead, Essentia continues to violate labor law with further unilateral changes and unfair labor practices, such as increasing patient load, call, floating, and threatening to close an urgent care. Essentia, we are calling on you again to come meet us at the bargaining table. It is time for you to be responsible stewards of your finances and end this costly legal fight. You have already had your day in court and lost. The NLRB ruled in favor of the APP union. It is time to work together to begin a contract and move forward. It is time to deliver justice for our patients who deserve the best of us. It is time to respect your APPs. It is time to show us that we matter to Essentia. Thank you.
As you have heard today, these constant appeals, Essentia's stonewalling, their claims of legal precedent, they're all calculated efforts by Essentia Health to destroy the advanced practice providers' unionization efforts. Essentia Health knows that the makeup of this APP bargaining unit is legitimate. Their own structure and processes show that. Essentia Health knows that the longer this fight takes, the more likely it is that this will never be settled. We're seeing that happen right now with other Essentia Health bargaining units, and this is another attempt at that play by Essentia. Essentia Health knows that the NLRB doesn't have a quorum. It's not functional, and it might not be functional for years. Essentia Health knows that they have more money than M&A and our APPs. And Essentia Health is using all of these things to attempt to destroy these workers' legal right to unionize. But rest assured that these advanced practice providers before you today and hundreds of their colleagues will not settle for anything less than a fair contract that protects them and puts their patients first. We can take any questions.